January 16th, 1945, Ardennes Forest, Belgium. The canvas walls of the field hospital shuddered as German artillery rounds exploded less than 200 yards away, shaking the makeshift operating table where First Lieutenant Mary Catherine Sullivan bent over a 19-year-old soldier whose left leg had been shattered by shrapnel. The overhead lamp swayed with each concussion, casting dancing shadows across the blood-soaked gauze and surgical instruments that lined the cramped tent. Outside, the Battle of the Bulge raged with desperate fury. But inside this fragile sanctuary, Sullivan faced a choice that would haunt her forever. Private Tommy Morrison lay unconscious on the table, his leg mangled beyond repair, while precious blood pooled beneath him despite the tourniquets that Sullivan's team had applied during triage. The morphine had run out 3 hours ago. The ether was gone. Even the emergency supply of local anesthetic had been exhausted on the previous 12 casualties who had arrived in waves throughout the night. Sullivan held a scalpel in her trembling hand, knowing that Morrison would die from blood loss within minutes unless she amputated immediately, without anesthesia, while German bombs fell around them. The young nurse had trained for moments like this at Walter Reed Hospital, but no classroom had prepared her for surgery under artillery fire with a patient who would feel every cut. 4 other Army nurses surrounded the table: Lieutenant Patricia Chen, Lieutenant Sarah Miller, Lieutenant Rosa Martinez, and Lieutenant Helen Thompson, their olive-drab uniforms stained with blood from the endless stream of casualties that flowed through their makeshift hospital. Each woman understood that the next few minutes would test everything they believed about healing, courage, and the limits of human endurance. Sullivan pressed the scalpel against Morrison's thigh as another explosion rocked the tent, causing the surgical lamp to flicker and instruments to rattle on nearby tables. Through the canvas walls, she could hear the screams of wounded soldiers waiting for treatment, the rumble of German tanks moving closer to their position, and the desperate shouts of medics bringing in fresh casualties from the frozen battlefield. In this moment, suspended between life and death, Sullivan embodied the impossible courage that German intelligence refused to believe American women could possess. What would you have done, cutting into a soldier's flesh while bombs rained overhead? The deployment of American Army nurses to European combat zones represented the largest mobilization of women for frontline medical service in military history. By January 1945, more than 59,000 Army nurses served throughout the European theater, with over 17,000 stationed within artillery range of active combat operations. These women had volunteered for military service, knowing they would face dangers that previous generations of nurses had never encountered, but few had anticipated the extreme conditions they would experience during the German winter offensive. American military medical doctrine had evolved dramatically during World War II to emphasize forward treatment of casualties as close to combat zones as possible. Field hospitals were positioned within 2 to 3 miles of front lines, enabling rapid treatment of wounded soldiers while they still had realistic chances of survival. This proximity to combat meant that medical personnel, including nurses, routinely worked under direct enemy fire while performing complex surgical procedures that determined whether soldiers lived or died. The Army Nurse Corps had recruited extensively from civilian hospitals, nursing schools, and private practice, attracting women who possessed advanced medical training and strong psychological resilience. Selection criteria included not only professional competence, but also physical stamina and emotional stability, necessary for extended service under combat conditions. The average Army nurse in 1945 was 26 years old, had completed 3 years of hospital training, and possessed surgical experience that exceeded many civilian practitioners. Training for Army nurses included field medicine techniques, triage procedures, and combat medical protocols that prepared them for conditions far removed from peacetime hospital practice. Nurses learned to perform surgery under primitive conditions, manage medical supplies during shortages, and treat combat injuries that civilian medical training had never addressed. However, no training program could fully prepare them for the psychological challenges of operating on conscious patients who screamed in agony. The medical supply situation during the Battle of the Bulge had deteriorated to crisis levels as German forces disrupted Allied logistics networks and winter weather prevented reliable resupply operations. Field hospitals that normally maintained substantial reserves of anesthetics, antibiotics, and surgical supplies found themselves operating with equipment and medications that would have been considered inadequate for emergency veterinary care. Nurses were forced to improvise with whatever materials they could obtain or salvage. German military intelligence consistently underestimated the role and capabilities of American women in combat support roles. German commanders assumed that American forces would collapse under pressure because they relied on women for critical military functions, believing that female personnel would prove unreliable under combat stress. This fundamental misunderstanding of American military organization and female capabilities led to strategic miscalculations throughout the European campaign. The conditions facing Army nurses during the Bulge exceeded anything previously documented in military medical history. Temperatures dropped to 15 degrees while hospitals operated in tents, barns, and damaged buildings without adequate heating or insulation. Nurses worked 18 to 20-hour shifts, treating casualties who arrived in constant streams, often while German artillery targeted medical facilities despite their protected status under international law. American field hospital procedures had been refined through 3 years of combat experience in North Africa, Italy, and France, but the Bulge presented unique challenges that tested every aspect of military medical doctrine. The volume of casualties exceeded planning projections by 300%, while supply shortages forced medical personnel to make treatment decisions based on available resources rather than optimal medical practice. The psychological demands on Army nurses were enormous as they witnessed suffering that exceeded human comprehension, while maintaining professional composure necessary for effective medical care. Nurses developed techniques for managing their own trauma while providing emotional support for patients who faced amputation, permanent disability, or death far from home. The mental health challenges were compounded by the knowledge that any mistake could result in preventable deaths. German propaganda had portrayed American women as weak, pampered, and incapable of enduring the hardships necessary for effective military service. This propaganda was designed to undermine Allied morale, while reinforcing German beliefs about their own cultural and military superiority. The reality of American nurse performance under combat conditions contradicted these propaganda themes so completely that German intelligence services initially refused to accept accurate reports about their capabilities. The medical innovations developed by Army nurses under extreme conditions would influence civilian medicine for decades after the war's end. Techniques for trauma surgery, blood transfusion, infection control, and patient management developed in combat field hospitals established new standards for emergency medicine that improved civilian medical care throughout the post-war period. The stage was set for a test of human endurance that would challenge every assumption about women's roles in warfare, medical capabilities under extreme conditions, and the limits of courage under fire. American Army nurses were about to demonstrate that healing could be as brave as fighting, and that compassion could be as powerful as any weapon in the American arsenal. January 16, 1945, 23:47 hours. 47th Field Hospital, Ardennes Forest. Lieutenant Sullivan steadied her scalpel against Private Morrison's thigh as another German artillery round exploded close enough to spray frozen dirt against the tent walls. The young soldier had regained consciousness minutes earlier, his eyes wide with terror as he realized what was about to happen. Without anesthesia, Morrison would experience every cut, every saw stroke, every moment of an amputation that represented his only chance for survival. Lieutenant Chen positioned herself at Morrison's head, holding his shoulders, while speaking in a steady voice that somehow remained calm despite the chaos surrounding them. "Look at me, Tommy. Don't watch what she's doing. Tell me about home. Tell me about your girl." Chen had learned that patients who focused on memories rather than pain could sometimes endure procedures that should have been impossible without anesthesia. Her technique had saved lives when medical supplies failed, but it required psychological strength that amazed the soldiers who witnessed it. Sullivan made the first incision with surgical precision that reflected 2 years of combat experience. Morrison's scream pierced the tent as the scalpel cut through skin and muscle, but Sullivan's hands remained steady as she worked to save circulation that could preserve the remainder of his leg. The blood flow was controlled through pressure points and tourniquets that Lieutenant Martinez maintained with mechanical precision, while Lieutenant Miller prepared surgical clamps for the arterial work that would determine whether Morrison survived the procedure. The artillery barrage intensified as German forces concentrated fire on the medical area, apparently targeting the field hospital despite its clearly marked Red Cross designation. Each explosion shook the operating table while threatening to collapse the tent structure that provided their only protection from winter weather and enemy observation. Lieutenant Thompson monitored a second patient who was bleeding out on an adjacent table while preparing surgical instruments for the next emergency that would arrive within minutes. Morrison bit down on a leather strap that Chen had positioned between his teeth, his body rigid with pain that exceeded human tolerance. Sullivan continued cutting through damaged tissue with movements that seemed impossibly controlled, given the circumstances. Her hands guided by training that had been reinforced through hundreds of similar procedures under conditions that would have overwhelmed civilian surgeons. The amputation required precise technique to preserve maximum function while removing tissue that would cause fatal infection if left untreated. The tent's overhead lamp flickered as German shells landed close enough to interrupt electrical power, forcing the surgical team to continue by flashlight held by Lieutenant Martinez, while Sullivan worked to clamp the major arteries that controlled Morrison's blood loss. In civilian hospitals, this procedure would have required a full surgical team, controlled lighting, and sterile conditions that were impossible to maintain in a combat zone where enemy fire threatened every aspect of medical care. Chen continued talking to Morrison about his hometown in Ohio, his plans to return to farming after the war, and the letters he had received from his fiancée just days before his injury. Her voice provided psychological anchor that enabled Morrison to endure pain that should have caused unconsciousness, while her hands maintained the physical restraint necessary to prevent movement that could have compromised Sullivan's surgical precision. Sullivan reached the bone that required cutting with a surgical saw that would complete Morrison's amputation. This was the most difficult part of the procedure, requiring controlled pressure that would sever bone cleanly while avoiding damage to surrounding tissue. Without anesthesia, the bone cutting would produce pain that exceeded anything Morrison had experienced, but delay would result in blood loss that would kill him within minutes. The surgical saw bit into Morrison's femur with a grinding sound that was audible even over the artillery explosions that continued shaking the tent. Morrison's body convulsed with pain that overwhelmed his nervous system, but Chen's grip and the leather strap prevented movement that could have damaged the surgical site. Sullivan worked with mechanical precision that reflected training designed for exactly these impossible conditions, her movements guided by muscle memory that functioned despite exhaustion and terror. Lieutenant Miller began preparing the arterial closures that would complete the amputation, while Lieutenant Martinez maintained pressure on bleeding that threatened to overwhelm their limited blood supply reserves. The teamwork between the 5 nurses had been perfected through months of similar procedures, creating coordination that enabled complex surgery under conditions that would have been considered impossible in civilian practice. The amputation was completed in 17 minutes, a time that would have been considered exceptional under optimal conditions, but represented near miraculous achievement given the circumstances. Morrison had survived the procedure conscious throughout, his survival dependent entirely on the skill and courage of nurses who had performed surgery under enemy fire without anesthesia or adequate equipment. As Sullivan applied final sutures to close the surgical site, German artillery fire shifted to other targets, providing momentary relief from the immediate threat of direct hits on the hospital tent. Morrison had lost consciousness from blood loss and exhaustion, but his vital signs indicated survival chances that exceeded anything the nurses had dared hope when they began the procedure. The successful amputation represented more than individual medical achievement. It demonstrated capabilities that contradicted every assumption German intelligence had made about American women's roles in warfare. 5 Army nurses had performed surgery under conditions that would have challenged the most experienced civilian trauma surgeons, saving a soldier's life while German forces attempted to destroy the medical facility where they worked. Within minutes of completing Morrison's surgery, Lieutenant Thompson received the next casualty, a tank crewman with severe burns who required immediate treatment that would test every technique the nursing team had developed for managing pain without anesthesia. The cycle would continue throughout the night as American nurses demonstrated that healing could be as brave as fighting and that compassion remained possible even under impossible conditions. Within hours of Morrison's successful amputation, word of the surgery began spreading through American forces with a mixture of amazement and gratitude that bordered on reverence. Soldiers who had witnessed the procedure described it in letters home as proof that American medical care exceeded anything available to enemy forces, while combat units throughout the sector gained confidence knowing that wounded personnel would receive treatment that could save lives under any conditions. Private Morrison regained consciousness 12 hours after surgery, discovering that he had survived an amputation performed without anesthesia while under enemy fire. His first words to Lieutenant Sullivan were, "Thank you for not letting me die," followed by requests to write letters thanking each nurse who had participated in saving his life. Morrison's survival became legendary among American forces as evidence that their medical support exceeded anything German forces could provide. German intelligence services received reports of American field hospital operations that described medical procedures performed under conditions German commanders considered impossible. Initial reports were dismissed as propaganda or exaggeration, with German officers refusing to believe that American women could perform surgery under artillery fire without anesthesia. The cognitive dissonance was profound. German intelligence had consistently underestimated American military capabilities, particularly those involving women. American military medical statistics documented dramatic improvements in survival rates for severe trauma cases during the Bulge, despite supply shortages and combat conditions that should have reduced treatment effectiveness. The survival rate for amputations performed in forward hospitals exceeded 85%, compared to 60% in previous campaigns, where anesthesia and optimal conditions were available. The statistical evidence suggested that nurse skills and determination were compensating for material disadvantages. Medical officers throughout the European theatre began receiving reports describing surgical procedures that exceeded anything in their training or experience. Colonel James Patterson, Chief Medical Officer for the 12th Army Group, wrote, "Our nurses are performing surgery under conditions that would challenge the best civilian trauma surgeons. They're saving lives that should be lost, using techniques that seem impossible given their resources and circumstances." American soldiers' letters home contained accounts of battlefield medicine that amazed families and medical professionals in the United States. These letters described nurses who remained calm under fire, performed surgery without anesthesia, and provided emotional support that enabled soldiers to endure procedures that should have been impossible. The testimonies contradicted German propaganda about American weakness, while demonstrating capabilities that exceeded European medical standards. German medical personnel who treated wounded prisoners began hearing accounts of American field hospital operations from American soldiers who had been captured after receiving treatment. These testimonies consistently described surgical procedures performed under combat conditions with effectiveness that German medical officers found difficult to believe. The reports suggested American medical capabilities that exceeded German military medical doctrine. The psychological impact on American forces was enormous as stories of nurse courage under fire spread through combat units. Soldiers reported increased confidence in their medical support, knowing that nurses like Sullivan's team would provide treatment regardless of conditions or personal risk. The morale advantage was immense. American forces felt protected by medical personnel whose dedication exceeded anything available to enemy forces. American war correspondents began documenting field hospital operations with articles that would influence civilian perceptions of women's roles in warfare for decades. These reports described nurses who combined professional medical skills with physical courage that equaled or exceeded that of combat soldiers. The media coverage challenged traditional assumptions about women's capabilities while documenting achievements that seemed almost superhuman. Allied medical services worldwide began requesting information about American field hospital techniques and training methods that enabled such effective treatment under extreme conditions. British, Canadian, and Free French medical officers sought to understand how American nurses achieved results that exceeded anything in their own experience, leading to international adoption of American combat medical procedures. German propaganda services struggled to counter testimonies about American nurse capabilities that contradicted their messaging about American weakness and incompetence. German radio broadcasts attempted to dismiss these accounts as fabrications, but the consistency and detail of soldier testimonies made such dismissals increasingly difficult to maintain credibly. The institutional impact within the U.S. Army was profound, as medical command recognized that nurse performance under extreme conditions exceeded every planning assumption. Recommendations were submitted to expand nurse training, increase supply allocations for field hospitals, and develop new techniques that maximized the capabilities demonstrated during the Bulge operations. American industrial capacity responded to field hospital supply shortages with emergency production programs that prioritized medical equipment and supplies for combat zones. The success of nurses operating under resource constraints demonstrated the importance of adequate support for medical personnel whose capabilities exceeded anything German intelligence had imagined possible. The cultural transformation was fundamental as American society gained new understanding of women's contributions to military victory through roles that combined traditional caring with extraordinary courage. Nurses like Sullivan had redefined concepts of heroism while demonstrating that healing could be as brave as fighting, establishing precedents that would influence women's military roles for generations. The extraordinary performance of Army nurses during the Battle of the Bulge triggered comprehensive revision of American military medical doctrine that established new standards for combat medical care and fundamentally altered understanding of women's capabilities in warfare. Medical Command recognized that nurse performance under extreme conditions had exceeded every planning assumption, leading to expanded training programs and resource allocation that reflected their demonstrated importance to military operations. American medical schools began incorporating combat medicine techniques developed by Army nurses into civilian trauma surgery curricula, recognizing that innovations created under battlefield conditions represented advances that could improve emergency medical care throughout the healthcare system. The techniques for surgery without anesthesia, pain management under extreme conditions, and psychological support for trauma patients became standard elements of medical education. The technological innovations developed by Army nurses included improvised surgical instruments, sterilization techniques using available materials, and pain management methods that enabled complex procedures without anesthesia. These innovations were systematically documented and distributed throughout American medical services, while research programs investigated the scientific principles underlying techniques that had been developed through practical necessity under combat conditions. International medical organizations requested detailed information about American combat nursing techniques that had achieved survival rates exceeding anything previously documented under battlefield conditions. The World Health Organization and Red Cross societies worldwide adopted American protocols for emergency medical care, recognizing that American nurses had established new standards for medical treatment under extreme circumstances. American military medical statistics from the Battle of the Bulge revealed survival rates that challenged fundamental assumptions about trauma surgery and patient care under adverse conditions. Soldiers treated by nurses like Sullivan's team had survival rates 40% higher than comparable cases from previous campaigns, despite worse conditions and reduced medical supplies. The statistical evidence proved that human skill and dedication could overcome material disadvantages. Post-war analysis revealed that American nurse performance had achieved medical outcomes that exceeded those of German military medical services operating under better conditions with superior supplies. German medical officers interviewed after the war expressed amazement at American medical statistics, unable to explain how American field hospitals had achieved results that German doctrine considered impossible. The research infrastructure developed to support combat nursing led to advances in trauma surgery, anesthesiology, and emergency medicine that influenced civilian healthcare for decades. The expertise gained through treating battlefield injuries under extreme conditions established American leadership in trauma medicine that attracted international students and researchers throughout the post-war period. American industrial capacity enabled mass production of specialized medical equipment designed specifically for field hospital use under combat conditions. The innovations included portable surgical instruments, emergency anesthesia systems, and trauma care equipment that reflected lessons learned from nurse operations during the Bulge. This technological development established American dominance in military medical equipment that continued throughout the Cold War. The psychological research conducted with nurses who had performed surgery under extreme stress contributed to understanding of human performance under pressure that influenced fields ranging from military training to civilian emergency response. The studies revealed that properly trained personnel could maintain professional effectiveness under conditions that exceeded normal human tolerance, establishing principles that guided training programs across multiple disciplines. American military medical doctrine was fundamentally revised to reflect nurse capabilities demonstrated during the Bulge, with expanded roles for women in combat medical support and increased resources allocated to field hospital operations. The new doctrine recognized that nurse skills represented force multipliers that could maintain combat effectiveness even when traditional medical resources were unavailable. The educational impact was profound, as nursing schools worldwide requested information about American training methods that had produced personnel capable of performing under such extreme conditions. The curriculum changes influenced nursing education for generations, establishing American nursing schools as international leaders in trauma care and emergency medicine. The transformation of Army nurses from medical support personnel into frontline heroes demonstrated that courage comes in many forms, some of which require steady hands and compassionate hearts rather than rifles and grenades. Women like Lieutenant Sullivan had redefined heroism through their willingness to cut into human flesh while bombs fell around them, proving that healing could be as brave as fighting and that compassion could triumph over impossible circumstances. The irony was historically profound and strategically significant. German forces that had dismissed American women as weak and unreliable discovered that their wounded enemies were being saved by medical personnel whose skills and courage exceeded anything available to German forces. The nurses that German propaganda had mocked as evidence of American decadence had become guardians whose dedication kept American forces fighting when they should have been defeated. The human dimension of this transformation revealed truths about the nature of courage and the power of professional dedication to overcome circumstances that should have been impossible to endure. Soldiers like Private Morrison owed their lives to women who had chosen healing over safety, demonstrating that some forms of heroism required facing human suffering rather than causing it. The strategic implications extended far beyond immediate medical care to fundamental questions about women's roles in warfare and the nature of military effectiveness. American success with female medical personnel proved that excluding women from military service represented a strategic weakness that American forces had turned into an advantage through proper training and resource allocation. The ultimate testament to American nurse achievement lay in the survival of soldiers who should have died, the continuation of military operations that should have collapsed, and the demonstration of capabilities that enemy intelligence had assumed were impossible. These women had saved lives under conditions that challenged every assumption about human limitations, proving that proper training and unlimited dedication could overcome any obstacle. Under fire, with no anesthesia, compassion cut deeper than steel. Stories like this reveal how American values of caring and dedication became weapons as powerful as any in the military arsenal, proving that victory sometimes requires healing rather than killing. In the next episode, we'll explore another hidden aspect of American strength that caught enemy forces completely unprepared. Would you have survived such a battlefield surgery? Subscribe now to uncover more untold stories of World War II.